This is a fishbone diagram that is used to identify possible causes of a problem and sorts out ideas into useful categories. This fishbowl diagram allows us to see how different factors led to this medication error. We have people, equipment, process, and environment. So for people, the registered nurse used poor communication skills um, with the provider to clarify the medication orders. The nurse did not adhere to patient medication administration rights. The nurse failed to scan medication before administration, failed to identify the right drug, the right dose, and the right reason. At this time, the RN was also training another nurse and could have been distracted while pulling the medications from the ADC. I believe the nurse should have communicated with her superiors that maybe she had too much going on at the time, and maybe they would have assigned someone else to go down there. As far as the doctor did not order the medication ahead of time. If the doctor knew that the patient would get anxious, he could have ordered the medication ahead of time, allowing the system to process the medication order before the nurse had to pull it. This could have also prevented the nurse from rushing. So the equipment, how did equipment play a factor? So technological vulnerability. The automated drug cabinet um, allowed the nurse to override the system to pull out medication not scheduled for the patient after typing two letters, the letters VE. The system should ask the reason the drug is being given and for the nurse to verify the dose and drug before it is removed. Typically, hospital medication cabinets are accessed by nurses, who can search them either by patient name or in urgent situations by drug name. With each additional letter that the nurse types on the search bar, the cabinet reduces the chances of selecting the wrong drug. These systems should require the nurse to type the entire medication name to minimize error. So, how did the processes play a role? There was no documentation of process, no standardized orders, and the nurse was essentially rushed. The environment, when we read this case study, the environment was chaotic, the nurse was busy. Because she was performing so many roles, they could have been understaffed. The nurse was precepting, she had patients and was being sent to the ED to perform a procedure for a patient. On her way down, she was sent to give the patient Versed before their procedure. This shows the effects of being understaffed. These factors combined led to the patient receiving vecuronium, the paralyzing agent, instead of Versed.